Derek Evans here, your host. Dr. Christopher Kane, Professor of Surgery, UCSD, in the studio with us today. Really looking forward to the Next Man Up event. I hope you guys do all that with Scott and BR again. It's a shame I couldn't make it. Really wanted to go. Want to learn this stuff. Our physical health, it's got to be number one. It has to be your top priority. It kind of reminds me of, when you're in a plane and they're doing the safety demonstration and they always say, put your own oxygen mask on before you help your kids. It's the same concept. You have to be, capable. You have to be physically capable to do things to take care of your family, which is what all of us really want to do. So it's got to be number one. This time of year, though, Dr. Kane, it seems like there's a lot of discussions floating around about flu shots, vaccines, a lot of people getting sick. My daughter's sick right now. And so, the big question is around, is the flu shot safe? Should you get it? There are a lot of people saying don't ever get a flu shot, never get a vaccine. Where do you fall on that?
I just think absolutely this is an area where there should be no controversy. The flu shot absolutely prevents influenza. Now, each year there's many different strains of the influenza virus. So the CDC and the flu shot manufacturers are constantly trying to change the flu shot to make sure each strain is represented. So it helps prevent as many of the critical strains of influenza as possible. But there's strong data that if you get a flu shot, your chance of getting influenza is diminished. There's about 70 to 80% of the strains of influenza that will occur each year are prevented by the flu. So not 100%. So just because I have I got the flu shot already this year doesn't mean I'm not going to get the flu, but it means my risk is tremendously reduced. And the data is so strong that many hospitals require their employees to get the flu shot. So at UCSD, all of our employees must get the flu shot. It's a condition of employment.
Wow.
And the reason is because we don't want a patient to come in and get exposed to an employee with the flu, where it's potentially preventable. And there's good data supporting that. So, I would encourage people to get the flu shot. Certainly, if you're older or have any health problems, you should get the flu shot. But I get the flu shot routinely because I'm in the healthcare industry, but I encourage my entire family to get the flu shot as well.
Okay.
Yeah, so I'm a strong advocate.
Okay. Well, what about vaccines? I know a lot of people, it's right along the same lines. A lot of people say, their kids are coming up, they're supposed to get, a whole bunch of these different vaccines, and a lot of people are really, really against it. Feel the same way about those?
I do. I'm a strong advocate. The data strongly supports vaccination. We've eliminated, for all intents and purposes, polio in this country, rubella, mumps. These are diseases that were extremely severe, killed people, crippling diseases that we've essentially eliminated because of vaccination. And the risk of vaccines is extremely low. Of course, it's never zero. So you're always going to hear a horror story of a bad immunization reaction. But I just respectfully come down strongly on the side of vaccination. I've done that. We have 4 kids, and we kept up to date with all their vaccinations, and I think that's the most data-driven and responsible way to be.
Does anyone get the chickenpox anymore? I remember getting the chickenpox when I was a kid, and I don't know if they came up with a vaccination for that or not, but I never hear anyone getting the chickenpox anymore.
Yeah, our kids got the chickenpox.
Did they?
Yeah, they did.
So that's something that still happens.
It still happens. Yeah. And we had a summer that my family still remember, sort of the summer of the chickenpox, that we were actually in Cape Cod, and one of the kids got the chickenpox. All the other kids got it. So, no, it still happens for sure. And but I think, the childhood diseases, there's a big outbreak right now of polio in Africa, and there's a big immunization going on in parts of Eastern Africa. And, what a terrible, disabling disease. And we have the opportunity absolutely to prevent it. So I'm a strong advocate.
Okay. Hard to argue with that. The science is the science. Let me ask you about healthcare reform, just because it's front page of everything right now. It's very difficult to discuss, logically and intelligently because there's so much politics attached to it. And I understand that. But at the same point in time, I think we should look at the reality here of how it's going to, affect things. For example, in your position, what do you see as being the effects of the cause being the new healthcare reform?
Yeah, it's a great question, and I agree with you. When I talk, at a dinner party with friends, it seems like such a polarizing topic. It's kind of like politics now in America, but it is going to happen, and the Affordable Care Act is happening. The health exchanges are happening, and so I think when we try and think about some of the positives that we should be grateful for. In San Diego, we think there's between 350 and 400,000 people who currently don't have health insurance or didn't have health insurance before the Affordable Care Act, who now will have health insurance. So that's great. And that's a bunch of low-income, in general, families, working poor and others of low income who couldn't afford insurance, who are going to have an opportunity to be insured. So I think that's the positive. And so we're looking forward to caring for those patients. And right now, I think a lot of folks don't realize that we really do see people every day, American citizens. We're not talking about, aside from the immigration issue, which is kind of a separate but related issue, we see American citizens who are employed who don't have health insurance and who get serious health problems and cannot quickly get health insurance. And I've taken care of young people with kidney cancer who literally, because their parents lost their job, they had no health insurance. And now one comes to mind in particular, a 17-year-old young man with kidney cancer, and he could not get health care. And he needed what ended up being about a $50,000 operation. And we had a process of approving charity care at UCSD where we'd apply and ask if we could deliver this, relatively expensive care, and it was approved, and we were able to take care of him. But there really was no place for him to get cared for. He'd been turned away, and there was no county charity organization that would care for someone with no insurance.
Wow.
So that happens to us every day. So for us, having an opportunity for those patients to be insured, to be in a health plan where we can provide that critical coverage, I think is reassuring to many of us. I think the other element that's positive is I have college-age kids, and they're just figuring out what they're doing with their life. So having an opportunity to put your children on your health plan up until they're 26 is really, I think, a relief for a lot of parents and a lot of teenage to early 20s kids. So I really like that. And I think the other element that I hope will be able to be completely executed is the pre-existing conditions will not allow or patients with pre-existing conditions will be able to be insured. And that's also been a huge issue where someone gets a serious health problem, something changes in their life, they change their job, they need to get new insurance, and now they can get insurance, but that serious health condition won't be insured by the new carrier. So that's been a real problem for a lot of patients, and so an opportunity to insure people with pre-existing conditions is the other positive. Of course, I understand the negatives. There's increased costs for a lot of employers, and and there's a lot of politics around whether you can keep your current insurance and your current physician, and I know that's the source of a lot of talk radio.
No question. There's no question. It's a source of a lot of consumer complaints, and that stuff makes its way, and that's just kind of how it is. And I definitely understand that pre-existing conditions, big issue, a huge issue. I know a gentleman a long time ago. He was one of those kids he had lymphoma at the age of like 21. I mean, just random. And so he's had to deal with those things before. If this had been in existence back then, it would have totally changed his life. I also understand people who can't afford insurance now having the opportunity to get insurance. That's also a good thing. But one thing, if they execute well, that could potentially be the best out of all of it is the free preventative care checkups. And I don't know how that's going to work exactly, but it seems like, people don't go to the dentist as much as anymore. They don't floss their teeth every day. They don't go see their doc every year and get those types of things. They don't check their levels or do any kind of blood work. They really don't know where they stand. And so you can sit here and you can have the fast food diet. You cannot exercise, and you can still live. The human body is amazingly resilient. I mean, when you see someone who's 300 or 400 pounds walking down the street, you can see proof of it right there. It's amazing how resilient the body is, but you got to know where you stand. You got to go to your health GPS and see exactly where you're at. And so I think that could be a really big thing.
Yeah, absolutely. I agree with you. I think if we can encourage and make the copay and any costs associated with preventive care and health maintenance really low, that would be a really positive thing.
Yeah, and that's apparently what's happening. Of course, a lot of things still untold with regard to it, and we'll get you as much information on it as we can. Dr. Kane, I really appreciate your time today. Thanks so much for being in the San Diego Spotlight.
Oh, it's my pleasure, Derek. Thanks for having me.
No problem at all. Look forward to having you again. That was Dr. Christopher Kane, professor of surgery at UCSD and one of the most experienced prostate cancer surgeons in the state of California. This is the San Diego Spotlight. We will be back again on Thursday at 2. We'll see you then.